All right, so let's start with the big story that we are tracking on WION at this hour. Remember, on the 23rd of March, there were several reports that emerged about the city of Bhilwara in Rajasthan. The question that was asked was, will Bhilwara end up going the Italian way? Now, about 20 days later, the story has now completely changed. Bhilwara has reported just about one case of a COVID-19 infection in the last 9 days. And all of this thanks to a massive containment operation that is now being hailed as the Bhilwara model that could be replicated, if need be, in other places across India. Now, the first case had been reported on the 19th of March. The district administration immediately sprung to action and imposed curfew under Section 144. The patient who had contracted the virus was a doctor, making the situation all the more worrisome. People were asked to stay at home, but essential services remained open. This was the phase 1 of the Bhilwara model. The phase 2 was a state of complete lockdown. The city and the district borders were sealed with checkpoints, and a similar request was made to neighbouring district administrations as well. The idea was to geographically isolate the virus. There was a complete ban on movement of private vehicles, and special containment and buffer zones were set up. Now, these zones became the focal points for the administration to work on. The next step was the identification of 6 hotspots in the district. Teams were dispatched to these hotspots to identify suspected cases. Disinfection was also done on a massive scale. The containment zones, ambulances, police vehicles and public offices were regularly disinfected to prevent community spread. The district managed to expand its quarantine infrastructure by roping in the hotels within the city. Nearly about 27 hotels with more than 1,500 rooms were turned into quarantine centres. The number of beds in the district hospitals were doubled, and 22 hospitals were also converted into isolation wards. Now, special teams